Hi, Dr. Alaimo here again. Today I want to talk to you a little bit about Hashimotos. Are you Hashimotos or are you not Hashimotos? That's the question. Most patients that are hypothyroid, which is a low-functioning thyroid, are usually treated in the traditional healthcare model by just managing TSH, which is one of the markers on your blood, and the traditional healthcare model basically balances out TSH with synthetic T4 and synthetic T3 hormones to just try to get a good reading on a lab, irregardless of your symptoms. The reason why I don't believe this is a good model to follow is because most patients, although they may have perfect TSHs, they're still suffering. So what could be the cause of this? The main cause of hypothyroid in the United States is Hashimoto's disease. Most of my patients have never heard of this. Again, I practice functional medicine. We help to restore the body to normal physiology, and we do this through natural means, diet, nutrition, and lifestyle changes. But it's important to get a good, accurate diagnosis to begin with. Now, the reason I say that most patients are Hashimoto's, research shows that 90 to 95% of all hypothyroids are Hashimoto's. Now, what that means is that your battle is not really with your thyroid, but with your immune system. And if that's the case, we need to regulate the immune system in an attempt to try to get it to stop attacking your thyroid. And that's why most of these patients are unresponsive to medicine. They keep switching doctors. They keep switching dosages. They have symptoms of hyper and hypothyroid. And TSH that's kind of uncontrollable even with medicine. So it goes real high 1 month and it goes real low 1 month. The real way to diagnose Hashimoto's, although those are good ways to kind of get a good baseline, the real way is to get a TPO antibody test done or a thyroid binding globulin antibody test done. These are relatively inexpensive lab tests that will definitively say whether or not you have Hashimoto's. And if you do, the real battle again is with the immune system and not with your thyroid. So why don't traditional healthcare providers typically run TPO antibody tests? The main reason is because it does not change treatment. That's just what it is. Their clinical goal and objective is to get your TSH to look good on a lab, again, irregardless of symptoms. So if your labs say you have a normal TSH, then you don't have a thyroid problem anymore. We simply don't believe that. And we know that if the mechanism of the hypothyroid is an immune response, then we have to regulate and control the immune system and try to get it balanced out with natural means in an attempt to try to get the body to stop attacking that thyroid. So again, at that point, your thyroid is really just an innocent bystander to an overactive or overzealous immune system. So if you want to find out if you're Hashimoto's, get the lab test done. Once you find out that you're Hashimoto's, and again, most of my patients don't know it when they walk in the door, but they do know it when they leave, then you need to get treated or managed for that. Thanks, and I hope that you contact our office if you have any questions or information that you need, 910-251-1620. And again, you can speak to our new patient coordinator and just find out how we handle Hashimoto's cases every day in our office. Thanks, and have a good day.